Hello. Hi, Ian. Just a quick question. I'm already logged in. Now, the link which I'm supposed to send out is the one which on top of the URL bar, is it? Aha. Oh, okay. That's a shorter one. Cool. I will send you guys that. That'll be easier for you guys. Okay, I'm doing that now, man. I think we should be on in another 2 minutes. I think I'm already live. I will just send you the link. Right? Okay, man. I put the importance of research in medicine. All right. Okay, man. Okay. Okay. Right. Bye. Bye. Hey, Ian, can you hear me? Okay, that's cool. If you can hear me, that's fine. Okay. So I guess you all saw me putting on my coat then. I guess we can start at 9:30 then. Is that okay? Okay, that's cool. All right. Hi, guys. I guess you all saw the advertisement. My name is Arvinder. Everybody likes to call me Dr. Arvinder for some reason, but anyway, I prefer Arvinder. My name is Arvinder. I'm a medical officer from Clinical Research Center, Perak. Um, so what has happened is we are actually MMI has actually approached me. The young medics has approached me for actually giving this talk on medical research, and I would like to thank the organizers for actually inviting me and presenting me the opportunity to actually give a talk on medical research. I think it's emerging field, and it's extremely important that young medicos or even those people who are thinking about venturing into a field of medicine actually be made aware that such things are actually happening in medicine. And I would like to thank the organizing committee, especially Ian and Priya, those two people who have been in constant contact with me regarding this particular webinar. And I'm sure they had a few heart attacks with me as well with how to use Google Hangouts, especially for this. I've not done this before. I'll be very, very honest with you. One of the first time, but I guess there's a first time for everything. So I guess without further ado, I will just actually now change over to my slides. So what has happened is yeah. So I guess I will just start off with this. So the importance of research in medicine as a doctor. So what do you guys know about clinical research may be very different for what you guys actually would need to know about clinical research. So my name is Arvinder, as I've told you. I'm actually a medical officer in clinical research, and I've actually graduated from AIMST University, and I also did my master's in health research under RCSI, the Royal College of Surgeons in Ireland, UK, and that was conducted in the Penang Medical College. And I've also done my occupation health medicine just out of interest and also out of boredom, strict boredom. And I've left my email address down there so that you guys can actually contact me if you have any questions. If you guys have any questions during the online, I've received some questions already, which I will share with you guys a bit later on. So I'm from the Clinical Research Center of Perak. As you can see on the bottom right-hand corner, we are actually attached with Hospital Ipoh. A lot of guys are going, hey, is this guy actually a doctor or is he a scientist or what the hell? Why is he actually talking to us about clinical research? There are no doctors in clinical research. Well, that's where you guys are wrong. I guess medicine has evolved into such a way that we have actually got now doctors in clinical research, and it is a whole new field which is actually evolving. I would just like to point out that orthopedics never actually started by itself. It was under surgery, and they finally developed they got their own field. And that's probably what is happening with clinical research. They're actually trying to break away from public health. And so a lot of people say, Arvinder, well, why did you go into clinical research? What's your story? Well, I think every story has to have its flaw, and I will bore you guys till the depth of it on how this story actually started. This story actually started at AIMST University. You can see this is my campus. This is my alma mater. I just love this picture, the way it looked, and this is actually showing our great hall. So this is the scene, and to be actually exact, the scene of the crime is actually at this particular building where is the library. Okay, the library of AIMST University, where I think a lot of my clinical research days began over there. And the reason I showed you all this and also this particular snippet of the web page is because it was actually nominated as one of the 50 most amazing university libraries in the world. And you can actually use this QR code at the sites which I've put here to go to that address, or you can actually just click in the link which is just below bestmastersprogram.org and have a look at it. So, with everything of all of this, you must understand that with every picture and there is a scene, you must know that who are the actors behind this whole story. So, as you can see, every good movie you have Tom Cruise, Jack Nicholson. In fact, you also have these two other guys here, Scuba Downing Jr. and I think that's Robert De Niro. And who are these two actors who are involved other than me? Actually, this is the scene at AIMST University. I have to pay special tribute to these two wonderful gentlemen here. On the left is Dr. Rajesh, Professor Rajesh, and on the right, Professor Hacharan Singh Sidhu. Now, these two guys were actually very, very vital in me getting into clinical research. And the story was something like that. I was actually walking one day over to Dr. Rajesh's room, as he was my mentor. Both of them are my mentors, but I happened to meet Dr. Rajesh that day, and I was walking up, and I had an interesting case which I saw in the clinics that day, and he came about and told me, "Hey, why don't you write this up as a paper and publish it?" I was like, "What do you mean by write up and publish?" He said, "That's where you are going to learn a lot of stuff." And he told me some very interesting facts. He said that if you read a journal, it's probably 2 years outdated, and if you read a textbook, it's about 5 years outdated. So that is why we actually have to get the newer textbooks. So medical students, this is actually a shout out to you to get the latest medical book out there, and also to read journals, because these are actually new facts which have probably been outdated in value. And think what these two Professor Hacharan, also the one on the right, who is the vice chancellor of AIMST University now, actually did support me a lot in my clinical research career and early clinical research career. And these two guys were actually vital in me having any sort of interest. When everybody else was actually interested in passing the exams, they were actually infiltrating ideas in me that, what do you know? Do you think it is current, or do you think it's outdated? And that really scared me a little, but prompted me a lot to actually feature into clinical research. So, and also one more thing these guys kept telling me was, after clinical research, what do we have all in common? Was basically Prof. Rajesh, Prof. Hacharan, and myself were probably all backbenchers. And they used to tell me, "Arvinder, you know what? You must, before you start any lecture and you keep talking and talking and talking, please be kind to the backbenchers, because you're actually being kind to your old or your new old self." So I actually start off with this take-home messages for today. I'm sure medical students will love this. Everybody knows that, okay, what is important for today? Yeah. Basically, what you need to know is medical research, actually what it does is affirm facts, disregard myths, we prove new facts, we remind us of how much we do not know, and that is where the medical field actually lacks these days. We actually do not honestly know how much we don't know, which is scary, because if you think that you know everything, mark my words, you are actually a disaster waiting to happen. So, discovery of new treatment and frontiers. The thought of medicinal advancement should excite anyone, especially those people in the medical field. I mean, how often do we actually wait for the next Android or the next iPhone to come out? That's how it should excite us. And it is an emerging field. Sadly to say, in Malaysia, it is still, I won't say even booming, I would say it is still creeping out of its caves, but I think we are getting there. And medical research will one day actually cause hospital to be self-funding and self-sustaining one day. What do I mean by that? Clinical research actually it has the potential of generating income and money, especially for any institution. And I think one day, especially even our government hospitals probably will actually be frontiers, and they will be actually conducting clinical research, and also as another means to sustain the production and the continuity of the hospital. So now you guys who actually want to know the main important points, you can actually go to sleep and take good rest. I hope you don't anyway, but you can continue with me as well. I would like to go on to my next slide. And a lot of you guys go and think at, hey, medical research, you know what? This guy is trying to make us a guinea pig and trying to do, actually, we don't actually make people guinea pigs. or people, we don't honestly do medical research by taking advantage of people. So a lot of you think that medical research is actually this. You're probably a guinea pig, or you are getting guinea pigs, and some of them will say, "Oh my God, a cute mouse!" And am I a cute mouse? Am I a mouse which in this whole thing? No, you're not actually. And some people actually go to the levels of thinking that they are actually victims of a guinea pig and or a mouse in a cage. Not really fair to say that. Not at all true, because you must understand that we are all bound by medical ethics, medical research ethics, the Helsinki's law, and of course the dreaded Nuremberg trials, which actually there were a lot of medical legal cases where a lot of unethical research was found. And at the end of the day, Helsinki trial was all the Helsinki Declaration was actually set up because of that. So none of this is actually true. Medical research has a lot of a lot of ethics, and there are a lot of stringent laws which actually do not cater for anyone to actually think about these three pictures. So what is medical research and medical field anyway? So it can be divided into medical devices, medical devices such as maybe your blood glucose meters. If you know that, if you remember in heyday, they actually needed to withdraw your blood from your elbow or your cubital fossa to actually take the blood and actually send it to the lab. But these days, we actually don't do that. We can actually have a point of care testing where your blood can actually be tested by your fingertip, and also you can be able to get a result nearly immediately. Medicational research, maybe new medications, maybe combination medications, which I will touch on a little later on, maybe different form of medications. Those days you have to only take pills. But these days there's also drinks available, which I will share with you a little later on. There's also medical research in policies. Those days you find that a doctor will just refer to the hospital and they immediately get admitted based on what the doctor say. But these days the policy is that you actually send the patient to the casualty. The casualty will triage the patient, because remember that diseases often change from time to time. So the door to needle time is essential, and policies change that way. And that is how medical research has also evolved certain policies that in our country. Sometimes we also want to look on behavior of staff and patients, whether staff behave in a certain kind of way, whether patients behave in a certain kind of way. All of this are something which medical research strictly and also looks upon strictly upon. And they can, that means you can be looking at medical devices and which can also change policies, which I will maybe talk to you a little later on. So if you want to know why research is important in medicine, you can actually remember it's actually the evolution of technology. I don't think that anything which is concerning technology these days will actually stay dormant. Everything moves with technology. And I think medicine is no different at all. And for those of you who remember, I mean, I was a little boy. I think probably half of you all were not born yet. But if you remember that many years ago, this was the phone which actually was a mobile telephone, which was actually attached to our cars, and it had a direct satellite connection. And I think in about a decade, this was actually the breakthrough in the mobile industry, where actually the mobile phone came to be very handy, really a mobile device which you can take out from your cars. New features of messaging, games, it took it to the next level. But you look at it now, these days we are actually dealing with smartphones, which is incorporated with our PCs, with our laptops, with our tablets. Everything is now on the go device on your hand. So that is how evolution has actually taken place. You still have a Nokia 3310, which is the centerpiece. Probably it is the best thing to break the floor right now. But I think the other stuff will, or the right one, the mobile device on the right, your Android phone or even your iPhone may actually break before it hits the ground. So I think medicine has also evolved this way, and that is why it is important. We actually got something which was very, very new and probably very difficult to use into something so friendly and so mobile that anybody can use these days, and that I think has taken a better effect on how medicine is actually practiced and how patient-centered care has actually improved. So I would like to show you guys this very funny picture right here. I myself couldn't help laughing when I saw this. I'll give you about 2 seconds to tell me what do you actually think. It's a quite common device which we use these days, but I have no idea what you think it is. Do you have any idea what you think it is? So here, whole extra device. This is now our latest new extra device. You can actually turn it 360 degrees and actually take for different angles. So that is actually what medical research can actually do. You get something new and you don't be complacent or happy with whatever you have. Don't think that medicine is all facts, 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 facts. Remember, facts change over a period of time. And remember, what you studied yesterday, it may not be true today. Remember, a journal is outdated after 2 years, which I was telling you earlier. Yeah. So you must understand that it is an evolution. Other than anatomy, any part of medicine which you study will probably change over the years. So this is another image intensifier, which is an X-ray, which is used commonly in orthopedic. So you can see the difference from the left to the right, how much has taken over a couple of decades. So a lot of people also say, hey, Arvinder, many years ago, this machine was actually created. What is your take on it? How does it involve medical research? It's a very interesting story, and why did I actually show this particular picture is because this is actually a shockwave machine. Now, what is a shockwave machine? Many years ago, we actually found that it will be easier to actually blast buildings with stones with a certain type of wave. For those of you who actually want to study neurophysics or even some sort of physics, you will actually understand that the sound waves, certain bombs which are created, ammunition in the US, actually for warfare, actually can destroy buildings with just sound waves. And I think this triggered a lot of uh, surgeons to actually think whether they could actually blast kidney stones by using shock waves. And this was one of the first few machines ever created. Now, why was medical research important in this? Because when they found over a period of time, hey, these guys were actually undergoing this stone blasting, actually had very little painkillers to take, simply because they actually have much better outcome in pain. So they were actually wondering, did these shock waves actually have any implication on pain therapy as well? And what happened because of research and because of evidence? All right, yeah, that was how the probe actually is. Now, because of research and evidence, you find that the shock wave today, that is it. And it's also used, as you can see here, it's being used on the foot for plantar fasciitis, a condition of the foot, which actually helps with the pain of the foot. Now, how did medical research help in this? It actually evolved from one particular bigger device to a much more handheld device, and that is how it becomes more mobile. Trying to imagine that you actually take a machine the size of the left hand into a kampong to actually treat patients who are having conditions, and look at the one on the right hand side, which you can actually take to the kampongs. Now, which one do you think is more feasible to? I think, of course, those on the right. So, medication in clinical research. So, if you remember, I think some of you who have seen your grandparents popping in so many pills, you will tend to notice that over a time and period, they actually forget to take their pills. They forget that, hey, I forgot to take this, I forgot to take that. So that actually deteriorates their condition, and it actually deteriorates compliance. So what medical research has done, it has also ensured that can certain medications be combined and be administered at one go. So instead of taking multiple tablets, you can actually take one particular tablet. Now, of course, having said that, you will also realize even for the medical devices, the smaller the machine gets, the bigger the prices get. The more number of tablets becoming into one tablet, the price is inversely proportionate. It goes from low to higher. And there is also a research which has been done to actually counter this problem, which I will share with you guys. But I'm just telling you what clinical research actually has done. It has actually improved patient compliance by merging all the pills on the left-hand side into this one particular pill, especially of those in hypertension. And you will not believe if I tell you that the doses actually in the combination pill is much, much lower because the efficacy of the medication becomes much better. So you can imagine the future impacts of that. Now, there are also a different, as you can see on this left-hand side is actually glucosamine tablets. You will also understand that in time and memorial, you only remember that medications only came in pills. Now, a lot of people, especially with glucosamine, it was actually a supplement. It was actually a registered supplement, which actually helps with joint pains. Now, a lot of people said, hey, you know what? I don't want to be popping in another pill. So some companies have actually taken heed of this advice or the patient's qualms that they may be already on multiple medications. How can they actually take this medication without thinking it's a medication? So as you can see, some of them have actually come up with this particular sachet, which is now a powder form. As you can see on the right hand side is powder for oral sachet. They mix it with water and they drink it. Of course, again, the problem here is probably cost, but I'm just telling you that with clinical research and to see whether the efficacy of both doses are actually the same, there is also actually developing their development of drugs or medications or supplementations which have been changing forms for easier administration so that patients become more compliant with. And that is how important medical research is. Sometimes, as I told you, behavior of patient and staff. Why are patients not taking their medications? Because they don't want to pop in another pill. Okay, let's give them a drink and see whether the medication can be administered as a drink. It works just perfectly as fine. Yeah, so maybe it improves patient compliance that way. So let me tell you some of the good stuff about clinical research. Basically, it actually starts with the discovery of newer drugs. What do I mean? If you actually follow the clinical research scene in Malaysia, you will find out that a lot of it involves chemotherapeutic drugs, diabetes, infectious diseases drugs, a lot of other particular medications. Especially in those infectious and neglected tropical diseases. So the usage of old drugs for new indications, some of the things that you actually want to know that, hey, this medication is used for this, like the shockwave, it actually was used for stone blasting, but at the moment, it is also used for orthopedic pain indications. So that is also a new indication. And sometimes certain medications you want to use are for side effects. And you want basically the side effect to be more than any other of that medication. So not only improvement, but how wrong we have been. I will give you a brief example about shockwave and how we were actually so far thrown off through an old ancient Chinese therapy. Medical guys used to think that, hey, you know what, this is actually not on. It's not acceptable therapy, but yeah, we have actually got different therapy and we are using that knowledge these days to incorporate it into modern medicine. Sometimes certain drugs have been developed. They're supposed to be state-of-the-art drugs. Like, for example, rosiglitazone was one of the diabetic drugs that actually came into the market. And post-marketing studies, they actually found that a lot of these patients were actually susceptible to having myocardial infarction or heart attacks, in other plain words. And the drug was actually withdrawn from the market finally. And what actually has happened is we I think even in Malaysia, this drug was withdrawn, and a lot of patients actually were saved from having another heart attack or a future heart attack by these drugs being withdrawn. Now, this was all possible from clinical trials which were actually conducted after that, and these were post-marketing studies. Now, sorry, I just have a question coming in. Okay, maybe we'll just move on to the question a little later on. Right. How about antihypertensive drugs? Now, there was an antihypertensive drug. I'm not actually entitled to tell you which drug, which was actually supposed to be renal and cerebroprotective. And there was a bit of issues with this particular medication because after the release of the drug, a lot of physicians found that, hey, we were not actually getting any hypertension control of the cerebral and renal protection. But why didn't we get any hypertensive effect or anti-hypertensive effect which the drug was supposed to initially do? And what they did was they discovered that there was actually a lot of issues with the drug, which I will share with you later on how medical research can actually what the bad stuff about medical research, which I think is probably up in my next slide. Well, there was actually some malingering which was going on, and the drug was actually finally withdrawn from the market. So, how about disease detection? Well, as you know, that those days it will take hours and hours for your blood results to come back from the lab to actually tell whether your diabetes was under good control, whether your HbA1c, which is another diabetes indicator marker, where it was under good control, whether you actually had dengue with your NS1, and also your rapid kits. Nowadays, you can actually do a lot of HIV rapid kits. It can immediately tell you whether the person is suffering from that condition or not. Now, it has become better. Whether it is more accurate is a different story, but as you know, devices are actually very stringently managed, and they have to have a very good sensitivity and specificity before they can actually be released. So these are some of the things which medical research has done. Tests have been actually, the results have actually been produced much faster, which actually helps the physician. I think you can also think about it this way. Many years ago, to check your blood pressure, you actually had to go to the doctor or pharmacy to actually check your blood pressure. But these days, you can actually get electronic devices to check it at home. Now, whether it is just as accurate as the mercury sphingomanometer, it may be not the case. However, you must understand that from going to the doctor these days, you can actually try and get a near accurate result at home. Now, that is how medical research has helped. Policies have been changed. I will share with you a little later on about a research I've done which actually changed the scene in Pahang. But probably all I can say right now is actually policies on how certain conditions and diseases have been managed have changed over the period of years simply because of clinical research. And good news for everyone who actually want to go into the field of medicine, it's also another career pathway in clinical research. Sadly, in Malaysia, we are still championing and fighting for it. I think we are almost getting there, but at the moment, it is not entirely concrete yet. But I foresee that it is one of the career pathways soon for doctors. Oh, this is an ugly picture there. Yeah, and yeah. So, what is the ugly thing about clinical research? Basically, I think with every good comes the bad. You must understand that there are many false research which are being conducted in this country. Maybe entirely by chance, or maybe purposefully being done simply because of monetary effect, which is the sad thing. Because clinical research should be done for the betterment of. So false research, fabricated results, as I was telling you just now about the antihypertensive drug, which was finally withdrawn from the market. False or fabricated publications, which was actually linked to fabricated results, are the ugly things which sends out the wrong message to people. One of the things which I would like to bring your attention to was, I think quite some time ago, through our anti-vaxxers in our country was actually using this particular reason to not vaccinate their children with MMR, saying that children who actually got the MMR vaccine were actually those children who ended up with autism. But that was actually not the case. When you actually go and see how the study was conducted, they actually went to a clinic and asked the parents of all the children with autism or children with autism will be actually asked to visit this clinic, and they actually sampled parents from there, and all of them actually had MMR vaccine, which is possible because it's part of your immunization schedule. Now, if you go to a place, I give you an example. If you want to find how many people are hungry, and you go to maybe a KFC or a McD's, and you find out that how many people are hungry, of course you're going to get a very high number, because these people actually went there probably because they were hungry to get a meal. So if you go to an autistic clinic where the patients are actually being diagnosed, or the doctors are trying to find out whether they are actually autistic or not, you go to this clinic to find out whether how many of them have been MMR vaccinated who get autism. It's something very silly, because it's like trying to go to KFC, find out a person who is hungry, who has money on him. Of course, they're going to have money and they're going to go and buy KFC or McD's because they're hungry. So that is how the false publication and fabricated results came about. But think about it. A lot of people out there, and probably maybe some of you who didn't even know this very fact, now suddenly you're thinking, hey, that was actually false, but they won't actually tell you that in the publication. You will get maybe a line in the newspaper saying, oh, this is probably the fact which is stated, and you will get some funny facts. So every time when you try and read something always try and confirm. There was one study the other day linking BMI with IQ, and I was amazed that I should have been the smartest person in the world, but that's actually obviously not the case. So a lot of people have been asking, why is actually clinical research important, and how much of importance has it got in Malaysia? Well, all I can tell you is, if you realize that in 2017, the government has actually enforced that in 2019, for us to actually renew our annual practicing certificate, you actually have to go for clinical practice or clinical CMEs, continuous medication, continuous medical education. And the reason for this is continuous professional development, which is your CPD, are actually frontiers which companies or even medical bodies use to present new evidence and new clinical research data, actually improve practices. So if we were to not enforce this, you will find that many doctors in Malaysia will probably be complacent with their knowledge and not renew their knowledge, and they may offer in some certain point later in time substandard care to patients. So as you can see, these days we're actually encouraging doctors to actually to better themselves, or to identify what is new, and for them to critically appraise what has actually been presented. And that, I think, is important in medicine these days, and this is all due to clinical research. So this is my favorite guy here, Albert Einstein, who said, once you stop learning, you start dying, and lifelong learning equals the ongoing, voluntary, and self-motivated pursuit of knowledge. Many years ago, you only have to learn once and apply. These days, you have to learn, you have to have the ability to learn, forget, and relearn. The reason is, if you don't learn how to relearn, you are actually going to be stuck at the old fact. Remember, when you started using Microsoft Office many, many years ago, it would have probably been just a word processor. But now, it can even be a web page designer, which has changed the frontiers of a lot of web page making. So think about medicine that way and clinical research that way. If you actually lose focus on what is new, believe me, you're going to grow older than this guy in this picture here. So as I was telling you, how did medical research actually change the frontiers of medicine? Many, many years ago or decades ago, you know that the Chinese physicians and also people in China were actually very good in doing acupuncture, and they actually said that, hey, acupuncture can actually relieve pain. Now, Western medicine actually came about and said, hey, you know what? That is absolutely rubbish. It doesn't work. Here, take a painkiller. Now, after a period of time, and actually probably I would say honestly from my heart, it's probably medical arrogance that people actually dismiss ideas before actually looking at the scientific process behind it. So as you can see, this man or this woman is actually palpating a certain point in the body and trying to insert the needle. Now these are called trigger point therapies. So a lot of it, yes, I understand that acupuncture, the problem of it is the needles may not be sterile, and the needles, I mean, I'm talking about then, may have been reused and may have caused some infectious diseases to be passed on from individual to individual. But the concept behind acupuncture itself could have been amazing. Now, brushing it off, many years later, they actually said, what if we use our medical needles, which are actually sterile, and see what actually happens? And they tried, and they found, hey, it actually works. Now, we can actually reduce painkillers which are being consumed by the general public to relieve their pain. But think about it. If there is a person who is going to be poked this much, of course there will be pain. And how is that actually going to help? Maybe for some people it may cause even more pain. So what are we going to do? And I think over a period of time, they also understood that, by creating these techniques, acupuncture techniques, it may also cause a diabetic to actually get infected wound. So many years down the line, they actually found that this is a shockwave machine, which I was telling you a little earlier on. It actually, it comes in the transducer. As you can see, it's being applied to a dog here, which actually is a knocking of two titanium plates, releasing a certain amount of sound wave energy that actually comes and actually heals, and it also reduces the pain. Now, the way they actually apply is actually at the trigger points. Now you can see that guy where he's actually pointing at the place where he's going to poke the needle on the left, the top left picture. Now, instead of putting the needle, they actually put the shockwave machine on top to actually transmit these sounds. Now, they have also been starting to use it on humans, and I'm one of the first few people. I won't say the first few, one of the few people in this country who have actually started using shockwave on patients, and I get quite good results, especially for those orthopedic and wound therapy patients. So as you can see, if those Western people who are actually thinking that, hey, you know what, we are not actually we are going to rebuff the idea of acupuncture, we would not have reached from the first top left picture to the bottom right picture, because it would have been rebuffed from that day onwards. But think about it, because there was someone who was actually willing to accept and learn, we have actually come a long way. And who has benefit from all of this? Humans and even animals in that. Yeah, that good-looking gentleman on the right is actually my father, and this is what I'm getting at. Many years ago, you can see how big I was, and how is it related to clinical research? I will tell you in a little later on. And this was a picture I actually took about slightly than a month ago, and this is how I look right now. What actually happened was I was actually not quite, I was actually quite very obese once upon a time. And I actually thought that something needed to be done. And you hear about multiple therapies, about people telling you, you can go for this therapy, you can go for that therapy, you eat this food, you provide this food. Say, hey, I'm a vegetarian. Some people say, hey, you know what, take carbohydrates, cut off your sugar. Some people say, hey, don't eat carbohydrates. What is actually right? So I decided to get to the bottom of this, and because being a clinical researcher, I decided to do a literature search and find out what was actually the evidence of weight loss. And after looking at it, I actually found a couple of ways to actually reduce weight. And also, remember, I was telling you that you can actually use a drug side effect to actually reduce weight. And that drug has been so long, or has been in the market for so long, used in diabetic many years ago. And the way it works is actually it suppresses your appetite. I've actually used that medication and actually reduced my weight to near normal BMI. And in case you're wondering, it was 4 years, 11 months, and 3 days ago, and I'm actually 58 kilos lighter. Now, why this all happened is because of medical research. And now the idea has actually been was caught on in the US. It's an idea actually I got from the US and also from the UK, which is being used there, and I'm also using it here, which is legal. It is an entirely harmless drug to use, but the effects are immense. So, as I was promised to tell you just now, some projects which I've been involved in. Well, there have been a bilirubin study which I actually did, which is the difference which was made in Pahang. We actually did a study to see whether the actual bilirubin machine that gave us a result for jaundice was actually the same as another fast equipment called the arterial blood gas machine, which also gave us a bilirubin reading. So what we actually did was we actually looked through the two devices, looked at what were the results, and we actually found that there was a 99% accuracy of the lesson machine giving the results. And we presented the paper in a couple of places, and what happened was one particular how shall I put it, the State Health Department of Pahang came and actually looked at our paper and our poster, and actually went back and spread this idea in Pahang, and now the idea has caught on in Pahang, which is actually quite amazing to actually see a lot of neonatal jaundice, which is actually being treated very far off the government hospitals, and they're actually getting those cases with very severe jaundice, which has helped. And I think a lot of babies have been saved that way. Now, this is one of my favorite studies of the knowledge of Kinta District Nursery Staff in Managing Common Paediatric Emergencies. How did it change policy? We actually went and looked at the Kinta Nursery Staff, whether they were actually trained to actually manage first aid emergencies, and the results were actually quite distressing. So what we did, we actually presented in a couple of places. We actually went on and also engaged our State Health Department, and also the national body for nurseries. And they have also they are in the process of actually applying this and telling that nursery staff actually need to undergo pediatric emergency, especially for those in choking and seizures. 4 months carried in a tertiary hospital. What actually happened was we actually looked at how whether there was transmission of organisms from patient to patient by actually healthcare professionals. One of my, as you can see, most of my topics are actually quite controversial, and I've been getting a lot of stick for it. But yeah, that's me being me, and I will tell you one of the studies which actually mentioned a little later on about how much of stick we got. This was my master study of the intention of doctors to disclose medical errors to their patients in a Northern Malaysian regional referral hospital. You can Google it online. It's actually freely available online. But how often would doctors actually tell their patients that they made a mistake? So I think the rate in our regional referral hospital was actually about 10.1%, and I think it has also gained national attention, where our Director General of Health, Dr. Noor Hisham, has also mentioned that probably with the emerging of medical legal cases, we may need to look at this hard. Now, this is a study I've done with a colleague of mine, Dr. Kavita from CRC Perak. Is a bullying among casualty doctors in Malaysia. We actually looked at a lot of casualty doctors within Malaysia, the tertiary hospitals, and she was actually the principal investigator, and we actually contacted a lot of doctors to answer our questionnaire of how many of them were actually bullied. She's actually in the process of writing up the results, but I can tell you that the results are quite staggering, and I think it will be one of those benchmark and landmark studies to actually share with the Ministry of Health to show that how hospital staff are actually being bullied by the general public. So as I was telling you, I was actually I get a lot of controversial topics. I was actually approached by a long-standing friend, Fu Pei-Ling, who's a pharmacist in one of the local health clinics, who actually said that, Arvinder, you know what? A lot of pharmacies are actually getting needle stick injuries in Perak. And a lot of people didn't believe her. A lot of people, I think, suffered in silence. They didn't want to say that they were having needle stick injuries. And the third part is they did not know what to do after a needle stick injury. So I think we did this study. We're actually writing up this paper right now, and that is definitely going to change policy as far as it's concerned, because we're probably going to start teaching pharmacists on how to actually manage needle stick injuries. And of course, I've been involved in numerous diabetic and infectious diseases studies, which I think is interesting because I get to play with a lot of drugs, which actually a lot of people, a lot of physicians don't actually get to. Of course, it is under supervision and of course under certain and strict ethics and dosages. But I think it's quite cool, in fact, to actually get to use a drug or actually see how effective a drug is. For your information of those people who are actually wondering about clinical research in our country, we actually get all those well-established drugs before we actually use it on our patients. And there's strict criteria which we meet. And we do not actually give the medication to the patients without their consent. It's actually only if they agree, then we actually enroll them into the study, and they actually exactly know what are the consequences, if there are any, for that. So I did mention about our nursery study, which we have done in Malaysia. You can actually Google and read and how we have actually gone and changed policies. And you can read on all these particular sorry guys, I just lost that feed. Just give me a moment, please. That's funny because you sometimes talk so much that you just forget everything. Right. So I hope you guys can actually, yep. So these are some of the things which we have done, which have actually caught attention of newspapers, and it has changed policies. So I would also like to end with a short talk about BABE. So a lot of guys are going, all right, man, he's going to talk about a babe right now. Actually, if you're thinking it is this type of babe, or for the girls going, oh, is that cute little, animal which we have actually looked at, a little pig goes a long way. Sorry to disappoint you guys. I'm actually not talking about this. but we're actually talking about bioavailability and bioequivalence. Now, remember many years ago when I actually told you that combination drugs were actually expensive. Now, after a certain period of time, you actually get other companies who have lost the original company, the original drug has lost its patency, and they actually other companies are allowed to manufacture a drug just as good as the original drug. Now, these are bioavailability and bioequivalence studies, and it has made an impact in Malaysia, where we are actually looking at generic drugs to see whether they are just as good as our local drugs. I show you most of them are just as good. And EPO, we are actually one of those centers which have actually just started bioavailability and bioequivalence study, and I'm one of the principal investigators in that. Um, we actually look for healthy volunteers, of course, entirely under their consent, so that they can actually consume only one tablet of this drug, and then we take a couple of blood samples to see whether it actually has the same effect on the original medicine. So anybody who is actually interested to actually enroll for the study can contact me directly. My email address is down there. It is actually quite interesting. Participants are actually told about the entire study. Nothing is hidden from them. And also, they will be compensated for their participation in this study. So if you have any questions about this, you can actually call me. And getting near to the end of my talk, these are three main bodies which I actually believe in clinical research in Malaysia. I come from CRC, which is the Clinical Research Center. We also have those industrial sponsored research, like I was telling you about certain drug trials, which is actually managed by Clinical Research Malaysia, who are doing a fantastic job in managing our clinical trials in Malaysia. And I'm quite proud to say that being a sister organization of CRC, they have done very well, and we are working well as a team. And of course, we also have a SCRPM, which is Society of Clinical Research and Professionals in Malaysia, which people like me, we want to find orang yang sama kepala dengan kita, who thinks about clinical research. So we actually joined this society to actually think, and there's a lot of training and a lot of training which we can do, which I actually got a question a little earlier on how do we actually do clinical research and trials, which I will actually just go a little later on. So just to quickly recap, I know you all are tired of me talking and mumbling to myself. So again, I will just recap of what is important in clinical research. Why is it important? It affirms facts, disregards myths. Remember how I told about the medication that did not work, about the new medications that work, how to prove new facts, remind us how much we do not know, which is very, very important. Discover new treatment and frontiers like the shockwave. The thought of medicinal advances should excite anyone. It is an emerging field, and it will cause one day of hospitals to be self-sustaining in the near future. Some doctorly advice. A lot of people say, Arvinder, I don't want my child to do medicine these days because they don't automatically get a job. I don't think you should actually force anyone to do medicine. Neither should you go into medicine thinking that it is an opportunity to make a lot of money. Believe me, there are a lot of other ways, legal ways to make money, to earn a living. Medicine is not one of it. I think it is the passion. So a lot of guys have asked me. In fact, I have a question here which I will go on a little later on about not wanting to do housemanship and probably going into clinical research, or finding an opportunity out. I don't think that's actually the right way to go. What we actually need is, we need doctors who are interested in clinical research. We need people who are interested in clinical research. We need people who genuinely want to do medicine. And I think that is what I want to tell all of you guys. Those of you in medicine, maybe you should actually think about the passion in medicine. It is not about the fame and glory of becoming a doctor. It is the passion of helping another human being. And don't do medicine because somebody actually forced you to do medicine. Don't do medicine because of the glamour. Do medicine because you want to do medicine. I'll end this slide with my favorite slide. It's a thank you slide. I used to wait for the lecturers to go into this slide. I used to jump for joy. This is a picture of my university from helicopter eagle's eye view. Still very close to my heart. I always love this picture. I always love this place. Thank you for your time. We'll probably go on to the Q&A. Yeah. For those of you who joined late, yeah, this is me right now. So let's see. I got a couple of questions right here, which I will approach.
So, David Joe from Malacca actually asked, "Hi, doctor. After medical school, is there a way to enter research and education directly without going through housemanship? Um, I love to teach. I don't think I will be happy in patient care in the long run. If yes, how do I start? Can I pursue a master's without housemanship? And does CRC offer medical students internship that will help them towards a full career in research and education? Thank you." Let's see. I also have another particular question. How do I get involved in research as a medical student? How do I go about picking up the skills necessary to do research, and other opportunities available? Okay. So, David Joe, I think I understand what you are saying. A lot of people actually want to avoid going into clinical practice these days. A lot of them would think that they actually want to become a non-clinical person. Well, David, I would just like to advise you that probably you may actually want to complete your housemanship, because I think after completing your housemanship, your whole world changes. I was always in medical school days, I always wanted to be a pediatrician, and I actually made ways to actually try to become a pediatrician. When I started working, I actually really wanted to be a surgeon. Um, yeah, call me bipolar, but yep, that was what I actually wanted to be. I wanted to be a surgeon, and I actually took up my papers, but one thing led to another, and some frustrations. The only other thing I knew how to do after that was clinical research. And I'm very glad that I completed my housemanship and my compulsory service, because at the end of the day, after clinical research, I know that I'm still able to see patients, I'm still able to treat patients, especially when industrial sponsored is concerned. Remember, I was talking to you about CRM and where clinical research and clinical trials actually happen. Yeah, so we actually managed to see a lot of patients that way, and I would like to say that you're actually able to still see patients, and it is not an education of waste. I would honestly think, David, you can actually pursue your master's without housemanship for a non-clinical field in clinical research, but I think that is coming to a change, and I wouldn't suggest you to do that. And of course, we do offer internship for medical students. You can actually write to Clinical Research Center. It is entirely based on uh, how shall I say, clinical research centers to clinical research centers. But you can actually come for an attachment with us, especially for those of you who want to do a small elective. And also from Narendra from you asked of how to get involved in clinical research. You may want to approach your CRC, but I think look for a good supervisor. There might be many university professors who are actually interested in clinical research. It is good to pick up from a person who is actually quite senior and experienced. And the skills and necessary, start small, start with a very brief or descriptive study, just for you to get your hands on, and then later you can move on to more complex things. But I think the most important thing is probably you will actually want to perform more clinical research, which is how shall I put it, which is actually ethical. And that is, I think, the most important. Do good clinical and good ethics research. Opportunities available. Well, I always say there's always an opportunity where research is concerned. You may want to approach your local CRCs to ask them more about your opportunity. But I think CRCs, they're always welcoming people to join them and to think and also do projects with them. I got another question here from Ong Xiao Yang from Fuyu High School. What makes you become a doctor, and why are obstacles are becoming over studying in medicine? Medical school wasn't a very easy place for me. I think because probably my studying at the start was actually wrong. I used to use a lot of memory power. I think over the period of time, we actually learned that it's not about memory power. It is probably about how you understand. Understanding is more important. I think you can be from any field. Don't memorize. Understand what you learn. That is the most important. And what made me become a doctor? Hmm. Actually, I was involved very heavily with the St. John's ambulance. A lot of people think that it was because my father was a doctor, and a lot of my family members were doctors. It's not the case. I think they all told me that think properly before you want to do medicine. And I think some of them actually discouraged me from doing medicine. But I think it was just my passion. And that is why probably I'm still in the field of medicine, even being frustrated with not going into surgery, probably with some of the frustrations in being in clinical research. But I'm still there, and I still have my own practice after work, which I also do private clinics outside. And I'm actually quite happy with my life. This is someone who I know, David Vishnu Kumar. What is the current trend of clinical publications specifically among junior Malaysian authors? And how do you predict this trend will change in the near future? I feel public awareness on Malaysia advancement in the aspect of clinical trials is low. In Malaysia, a significant contributing member to a realm of clinical research, are we making groundbreaking advances in this particular area? Well, I suppose that when you want to get into a clinical master's these days, they actually request you to actually have a clinical publication or clinical research publication. We are getting that to junior Malaysian authors. But a lot of people ask me, Arvinder, how do I get and do research? And I was like, why you, how come all of a sudden? I mean, what prompted you? Oh, is to get masters. Oh, is to get my KPI done for the year, key performance index. Don't think that's quite right, the idea. I think probably we are actually looking at people who would really want to do clinical research for the sake of the betterment of patients. Not really, I think, for how shall I put it, for their own priority. Yeah, maybe you may want a bit of your own priority, but I think mainly it should be how to actually better the patient system in our country and how to make patient care better. Groundbreaking advances in the particular area of clinical trials. Yeah, as I said, that we have CRM, we have aspiring doctors, physicians, surgeons who are actually engaging themselves more and more into clinical trials. And that is where my job comes in. Being a clinical research doctor, you actually help facilitate all of this, and they're actually quite comfortable that we're actually like I look at myself and my colleagues from CRC, EPO, who are medical officers, who are a bridge between the doctors who are doing clinical research and the statistical and research part of it. So that is where I think our job is important, and that is why I think we need a clinical pathway for it. So I hope I did answer these questions. I have a couple of questions here. Please keep your questions coming in if you have. So how much funding is provided for medical research in Malaysia as compared to other neighboring countries? Ooh. Oh, it's a tough crowd, huh? And what are the important steps we need to take before submitting a particular paper for publication? First and utmost important thing is actually to register with the National Medical Research Registry, NMRR. You can access it at nmrr.gov.my. You actually have to register your study, share what research was actually done, and register it, and then you will have to send in your publication for approval. You must remember that no publication in this country is possible without the Director General's approval. And I think it is important that we know what studies are being conducted in our country, because remember, it should be ethical, and if it's ethical, it will benefit patients' research or patients' outcome. Whether good or bad, negative or positive outcomes, it will serve as a teaching purpose for other people. David, who actually wanted to go into teaching. You can actually practice and teach at the same time, which what most of these guys are actually doing. But I think at the end of the day, sharing clinical research is one of the most important tools in medicine. And how much of money do we get in our country? It's kind of tough. We have the Malaysian funding agency, the name just doesn't click right now. Is the Malaysian funding agency, MRG, Malaysian Research Grant, if I'm not mistaken. And they actually fund research. It's not entirely easy. Of course, with our current budget crunch, we don't get too many people with clinical who want to come in for clinical research and also, fund clinical research. But I think there are a lot of other outer bodies who are actually funding it. A lot of journals. Actually, the most expensive part about a research is actually publication. And I think there are quite a number of journals which are coming out to actually help with those fundings. they may charge 2,000, 5,000 US dollars, but they actually give you quite a substantial discount when you actually need it. Yeah. So, do I have any more question, guys? From anyone? So, I think if there are no questions, maybe we can end this particular session. Just a quick word of advice to everyone. I think going into the field of medicine is quite a challenging thing, but please do not be discouraged with what people say about, you know, it being overpopulated, overcrowded. It's not. It's not really what that's happening. We still will need doctors in our country. Go into medical research for the passion of it, not not for, not for the not for the sake of money, not monetary gain. So with that, I would like to thank MMI for inviting me, and also all those people who actually post questions. Really happy to be here. I'm actually very willing to come back and talk to MMI. Don't know how much of guys you guys want to invite me again after my long-winded stories, and but yeah, thank you very much, and good night. Have a good weekend, guys.